Hey guys, today we're going to talk about pressure ulcers and how to prevent pressure ulcers from happening. So the people that are going to be part of our team, obviously the CNA and the nurse, right? We're working together to prevent this from happening, keeping our residents and our patients safe. That's what our job is. What we need to know is the relationship between blood supply and tissue destruction. So just like when we talked about strokes and heart attacks, any tissue that's not getting a supply of oxygen is going to start to die, and that includes your skin and your subcutaneous tissue. And when we have pressure for a long period of time, that area is not getting the blood flow that it needs, it's not getting the oxygen it needs. Eventually, that tissue is going to die. Okay, so it is our responsibility to make sure that we're positioning our patients and our residents so that they're getting that blood flow to those areas and their tissue is not going to be destroyed. Other names that you might hear are decubitus ulcers, dermal ulcers, bed sores. These are all wounds that are created by pressure. They're the same thing as a pressure ulcer. Okay, yeah. So people that are at risk. Pretty much the population that we're taking care of for the most part. Elderly people because they don't have that good blood flow like a young healthy person might have. Somebody who's very thin, they don't have a lot of cushion, not a lot of protection. Someone who is bedridden, especially if they have no ability to move themselves or if they don't have any sensation. They don't know that that tissue is being destroyed and then it's starting to break down. Or if they are nonverbal or phasic for some reason, they can't tell us, hey, I'm really uncomfortable, I need to move. Those people are going to be very high risk. If we have somebody who's incontinent of urine or stool, that means that they're going to be wet more frequently, then that's going to put them at risk for skin breakdown. You know, if you've had a baby or ever taken care of a baby, you know if they sit in that wet diaper for a long time, they're going to start getting a rash and they're going to start having some breakdown eventually if you don't change that. Poor nutrition and dehydration. You know, your body needs good nutrition to keep rebuilding and regenerating. So if you're not getting enough nutrition, especially protein, those amino acids, those are our building blocks, we need those, then you're going to be at high risk for breakdown. But also when that breakdown occurs, you can't heal because you don't have those amino acids to build new cells. So when we do have somebody that has a pressure ulcer, we are very concerned that they are getting the proper nutrition. Impaired circulation, that could be peripheral vascular disease. If somebody has diabetes and they have bad circulation, or if they have neuropathy where they can't feel their feet, they could end up with a pressure ulcer on their feet and not even realize that it's happening. And then friction and shearing. These are two important terms that you need to know. So friction, we already know, is two surfaces rubbing together, creates friction. And if I did this long enough, you know, I'm sure my skin would start to break down because of the friction. Shearing is also important to know, though. This is somebody that we might be pulling up in bed, like this person right here. Okay, I'm pulling them in one direction, but their skin is sticking to the sheets. And so their skin is moving in one direction and the bones are moving in the opposite direction. And that's going to cause this tissue here to tear. Okay, that's shearing. And that's going to cause deep injuries. So we need to be very careful when we're moving our residents and our patients in bed that we're not causing these problems. Any place where bone can touch bone or where bones come close to the surface of the skin is going to be at high risk for skin breakdown. So you could probably go down your body and pinpoint those areas. You know, there's areas of your body like your elbow, all right? There's not a whole lot of tissue or skin in there. So that's going to be at high risk for breakdown right there. I don't have any cushion there. So if this were to touch a hard surface for a long period of time, it would start to break down. These are our hot spots that we need to worry about. Other things that can happen that can cause breakdown, obviously, if you have somebody that's large, obese, skin folds under large-breasted women underneath those breasts, and the crease of the buttocks, especially if they're incontinent, that's going to start to break down. In between thighs, too, if you have somebody who's laying in bed and their legs are touching each other, you know, and there's friction, they're rubbing together, then that could cause breakdown. We also have to worry about, you know, fungal infections happening here, yeast infections. So we need to keep those areas clean and dry. Okay, so don't neglect those areas when you're bathing somebody. Really take a good look and make sure that there is no breakdown happening. Here's a nice picture of all the areas where skin breakdown can occur. So the places that you will see it most frequently, sacrum right here, okay, and the heels. Most of the population that you're taking care of, those are the two places that we worry about the most. But it can happen anywhere. If you have an infant, for example, we worry about the back of the head because they don't have a lot of cushion back there and they're laying in bed constantly. They can end up with a pressure ulcer right there. Anywhere where two surfaces are touching each other or where the bones come close to the skin. So this is preventable. Okay, and prevention is key because once it's occurred, it's very hard to treat. Sometimes we can't heal these wounds and people die with them. So our job is to prevent them from happening in the first place. So we need to keep the skin clean and dry, especially if we have somebody who's incontinent, checking them frequently. You guys are probably going to see orders on people's charts to check every 2 hours to make sure they're clean and dry. We got to get that urine and feces off the skin. Urine is very acidic, so that can really irritate the skin. And if you have somebody that has diarrhea, you need to be checking them and changing them as soon as you see anything. You might also see an order to reposition every 2 hours. If I have somebody that can't move themselves or can't move themselves well, I need to do that for them. You know, if you just were to sit in the position that you're in right now and not move a muscle, you would see it wouldn't take you very long to become uncomfortable. Maybe you want to try that one day. Just try to stay in one position for as long as you can, not move. It's not comfortable. So every 2 hours might sound like a lot, but it really isn't. It should be at least every 2 hours. Not every 2 to 3 hours or 2 to 4 hours. At least every 2 hours you need to be moving that person. Sometimes students are like, well, what about when they're sleeping at night? Yeah, you need to be moving them at least every 2 hours, even at night. Okay, because I don't want to come in the morning and check on them and find a big pressure ulcer because somebody decided not to move that person all night. This breakdown can happen pretty quickly. Okay, it does not take long. So think about, if you've ever crossed your legs, that big red mark on your leg. If you were to keep your legs like that for another 2 hours, you'd end up with a pressure ulcer. Fortunately for you, you're healthy, so you probably know, oh, this is getting uncomfortable, let me move myself. But the people that we're taking care of are vulnerable. So we're doing that for them. So other things you need to do, make sure clothes are not too tight, like this guy right here. His pants are a little tight here. I'd be concerned about that. If their shoes are too tight, especially people who, again, have no sensation, like our diabetics, they might not have any feeling in their feet. So we have to be responsible for making sure that those shoes fit properly and they're not too tight. Okay, I don't want to come in and see somebody's sock like a tourniquet around their foot and their foot is purple. Keeping linens clean, dry, wrinkle-free. We already learned about getting all the wrinkles out if we can, making sure there's no wrinkles, no t-shirt folded up behind their back, nothing laying behind them. They're not laying on their call bell. Using proper lift equipment, always having at least 2 people to pull somebody up in bed. Don't try to be some kind of superhero and do it yourself because you're just going to hurt them and you're going to hurt yourself, okay? So nobody will be impressed with that. So get some help. And then we have different equipment that we use to protect areas like elbow and heel pads, which I'll show you a picture of in a minute. Hopefully, you already know if you see something, you need to report it right away. Not at the end of your shift, but if you were to walk into your residence room in the beginning of the day and you see that they have a new reddened area on their back, you should immediately go and tell the nurse. Okay, don't wait because we don't have much time to prevent that from breaking down further. So if it's something that you turn them and the redness goes away, that's pretty normal. But if you see, well, this really isn't changing color, especially if you touch it and it does not blanch, it stays red, that's a problem. Or if you have somebody with a pressure ulcer and it looks like it's getting worse, or maybe you see signs of infection like increased redness, swelling, drainage, an odor, you need to let the nurse know. Here's a bed cradle. Okay, somebody would have this on their bed to prevent the blankets from laying on their legs and creating more pressure. So it doesn't seem like that would create a lot of pressure, but if you have somebody that can't move, those blankets just sitting on their feet, it's pushing their legs and their heels into the bed. So this bed cradle prevents that from happening. Keeps those blankets off the feet. So here's some heel booties and elbow pads. So we know heels and elbows are high risk areas because, you know, there's not a lot of cushion there. And those heels, that's one of the most frequent places that you're going to see that skin breakdown happening. We don't like that to happen because it's, you know, that area sometimes has poor circulation anyway. So once it's happened, it's so hard to heal. You might also see special pads and chairs, wheelchairs. They might have a specialty mattress even. There's so many different types of mattresses now. They have ones with sand in them. I know Bay Health has mattress. I think all of their beds now have areas that change pressure inside, so you feel it pumping up and decreasing in one area and increasing in another. A lot of people don't like that, but if you have somebody that's high risk for breakdown, that's a great thing. You know, and if you don't have all this fancy stuff, then just do it the old-fashioned way. Use pillows, blankets, whatever you have to get them off of those high-risk areas. So positioning is a skill that you will learn in class if you haven't already learned it. In pillows, we use these to float heels. One of my biggest pet peeves is when I walk into a room and I see people have done this incorrectly. So if I haven't already shown you, remind me to show you in class the proper way to float heels. Proper way would be to put it under the calf so that the heel is floating in the air. If I come in and I see a pillow under somebody's knee and their heel is touching the bed, now I've just made the problem worse, right? Because now the heel is at an angle and it's creating more pressure. So I defeated the purpose, all right? Or if I come in and I see the heel is sitting on a pillow, you haven't actually done anything. So the heel needs to be floating. That means nothing is touching it. It's really not difficult, but you would be surprised how often you find that. We talked about this, water beds from the 80s. They're back. Now we use those to prevent pressure ulcers. Prevention is key. We already talked about that. So now we're going to talk about the different stages of skin breakdown. Okay. So basically we have 4 stages here. So stage 1 is when the skin is still intact, but it's reddened. Okay, so you walk in, you see a big reddened area on somebody's sacrum, and you press it, and it blanches, you're fine. If it doesn't blanch, then you have a stage 1. Okay, and that means that first layer of skin, epidermis, is now has some damage, and I need to be very vigilant in preventing any further damage. Stage 2 is a partial thickness skin loss. So you might see a blister or a little opening, okay, like a popped blister. So now I've lost that first layer of skin. Stage 3 is full thickness, so I'm getting down to the subcutaneous tissue. I might start seeing some fat. Stage 4, I am now seeing bones and tendons. And stage 5 is what we call unstageable. This dark, thick, black scab is really what it is. It's preventing me from seeing what's underneath. So I don't know how deep this goes. I don't know how big it really is. It could be huge under here. And I'm not going to touch that. It's almost like your body created its own wound dressing here. I'm not going to take that dressing off. The only person who should touch that is a surgeon or a wound care nurse. Okay, so we're just going to leave that there and we're going to say this is unstageable.